Right, so my name is Sarah Olson, for those of you who have not met, and I'm the Director of Health Research at the Wildlife Conservation Society. So when I share stories about visiting Western lowland gorillas in the Northern Republic of Congo, Ebola virus is rarely the first thing that anyone ever asks me about. But this looming threat is a central focus of our wildlife health program in Congo, as 20 years ago, there were massive die-offs of gorillas and chimpanzees in Congo, Cameroon, and Gabon. Now these die-offs were, where was it going? There we go. These die-offs were concurrent with human Ebola outbreaks where Ebola virus was detected in a number of great ape carcasses. So it's estimated that the great ape suffered over 90% mortality, and within a 40-kilometer radius of one protected area, it's estimated there were about 5,000 gorillas that died. So epidemiologic investigations of the outbreak showed that the virus spilled over into humans, into the human population from direct contact. So this means contact with infected wild animals, and the index cases were hunters, butchers, or people handling raw meat from a wildlife carcass. So therefore, in the mid-2000s, our wildlife health program partnered with the Ministry of Health to establish a long-term wildlife mortality reporting network and program. And this network really involves three primary pillars. First, direct engagement and educational outreach to rural communities. Second, capacity for rapid response and safe carcass sampling. And third, engagement by sharing of the results back to the communities as soon as possible, as well as with our public health partners. So we follow, of course, the local protocols and practices to share information in the community through meetings to help dispel the belief that Ebola is the result of sorcery. It is a virus, and it likely originates in bats. And moreover, there are a couple simple steps that can be taken to limit exposure when you do encounter a carcass. So namely, do not touch, move, or bury the carcass, and give us a call. Some of the first instances of giving a call was actually like pieces of paper that were passed along the main highway in taxis, and they would reach our office. Now we have mobile phones, and then we also listen to the experiences, and we probe for understanding of what they are experiencing with questions back to the group. So it's a coupling of outreach and surveillance action to protect the health of these communities that are living in close contact with wildlife, and it also provides an early warning system for wildlife managers to mobilize resources if a die-off is triggered or underway. So we recently updated the posters that are left in the village that you can see here. They're both in Lingala and French, and we use a diversified the messaging to target both men and women recently, and the messaging is also broadcast over local radio channels. We're collecting data in an IRB-approved study on the frequency and what type of carcasses are encountered in these communities, and another study we are now starting to evaluate how effective our outreach is. Excitingly, the team is also, this is one of their ideas, to now introduce both theater and songs to the outreach. In the last 3 years alone, the outreach team reached 170 villages involving about 4,000 community members. The network itself has grown to an area that covers more than 50,000 square kilometers with an annual estimated cost of about $33,000 per year. So it's built on some core programming, but it just gives you our starting point for how much this type of surveillance costs. So what happens when a report is received? So we've trained about 100 staff partners, men and women alike, who work in different protected areas, and this helps shorten the response time. So we have a small sampling team that mobilizes and arrives at the reporting village as soon as possible, with the stipulation that we do not drive at night. The team checks in with the village chief, and somebody who knows where the carcass is located accompanies the team, and then they put on the PPE. We first responded to Ebola outbreaks in 2004, and so we use a 2-person sampling protocol that's been co-developed with NIH partners that builds on lessons learned from the West Africa outbreak in 2014. There are kind of 3 pillars: redundant biosafety, a buddy system that allows the samplers to kind of watch their partners' tasks, and the use of minimally invasive swab sampling. Although the protocol was designed with field limitations in mind, it does get really sweaty and hot inside those Tyvek suits. So there are about 100 carcasses sampled to date and tested with this surveillance effort, everything from great apes to elephants to bongo and red river hogs. Fortunately, every test so far has come back negative for Ebola viruses, and that information flows directly back to the reporting village as soon as possible. For this, we're of course really thankful, but we remain vigilant. There are cases popping up in neighboring DRC. Pictured here is Biomeme Training, which is a new field-based diagnostic tool that we're using to run RT-PCR for Ebola virus Zaire. It runs off of a smartphone. So practically, this means we're able to relay the initial results back to the village chief on the same day that we collect the samples, with additional samples sent to the National Public Health Lab in Brazzaville, but it ends up speeding the response time from 2 to 3 days down to hours. So just as an example of a win for public health in these rural communities at the front line of spillover events, and a win to help track and understand the conservation threat to great apes across Africa. And big credit here to my colleagues, Dr. Alan Onzi and Eva Kusuma, who have been leading most recently on this effort in the country.